occupational therapy. So in paediatrics, OTs work with the child, their parents and their family together and the teachers to help improve the child's quality of life through helping them with their learning, play, making friends, what other areas? Yeah, also helping them to look after themselves, so helping them dressing and all the rest of those kind of things. Kids have kind of worked with a range of people, so kids with autism, developmental disabilities such as Down syndrome, also not specific disabilities or diagnosis, but kids that are just having difficulties with handwriting or reduced strength and they're having difficulty with catching balls and different things like that. So this includes a lot of playing, which is very cool. So yeah, that's pediatrics. Yeah, so the next one. Oh, hands and upper limb. I just want to crack in this area. So we, in OTs and upper limb, we specialise in providing rehab to the hand and upper limb. So when people have been in injuries that have affected been in accidents and have injuries that have affected their upper limb, also if they have diagnoses such as arthritis that affect their ability to use their hands. So people kind of see with nerve injuries, tendon injuries, fractures. So a good example of this would be on my placement where we had multiple people come in following car accidents and motorbike accidents that have lost all function in their upper limb. So we provide rehab for that. Not only rehab to the actual arm and hand, but also teaching them ways to engage in meaningful occupation without being able to use their upper limb. So yeah, that was that one. In mental health, we work with a lot of people with ranging diagnoses, so schizophrenia, depression, anxiety, bipolar, personality disorders, and focusing on re-engaging them in meaningful occupations, returning to work. In this area, it's a lot of group therapy, so it could be education, support groups, also creative groups. We can do lots of art therapy and relaxation therapy. It's really interesting. Also one-on-one counselling, and we work very closely with them. You can be a case manager for that as well. And rock rehab. So you can see from what I've just spoken about how wide and varied OT is. We've gone from playing with kids to FIFO, fly in, fly out, working in the mines. So in rock rehab, it's a lot of focusing on when someone's had an injury in their workplace, then you're returning them back to work, so you return to work programs, workplace assessments, risk assessments, adapting the environment so that people can engage in their work. So this one's, a lot of report writing as well on this one.
So we all did a placement last year in aged care where we spent 14 weeks working within a variety of homes of low and high care. I was working in a low care facility where we were given 4 clients that we worked with, and we got to work through the whole OT process. So beginning from meeting them through to working out what they want to achieve in their life and through to concluding and exiting with them. So aged care is probably an area not many people are very interested in. Some people are, some people not. I personally wasn't really that interested in aged care to begin with, but following this placement definitely changed my perspective on how, or the role of an OT with elderly people. So it's really about not just putting them into a nursing home, it's about still making them engaged in things that they really enjoy doing post that, and just because they're getting old doesn't mean that they shouldn't be doing the things they love as well. So that was a really rewarding placement. One experience I had working with a lady who was quite socially withdrawn, wasn't really interacting with any other residents that were at the home. My partner and I were able to really interact with her and engage through an occupation that she valued, so that was crocheting. She managed to teach us how to crochet, and she really opened up through this experience, and it was a really rewarding experience to be able to connect with someone that wasn't really talking to anyone else, so that was a really good experience with that. And then the next one, so we also work a lot through rehab and home visiting. So my placement in Albany recently was based on a rehab ward, and there was a lot of home visiting involved in that. So basically when they come to a rehab ward, they're medically stable, so there's they'll come admitted to hospital and they're managed with their medical conditions, and then they'll come down to the rehab ward. And they also have to be willing to participate in rehab as well. So sometimes people are really motivated to want to get out and improve their function, other times they just kind of want to coast along. So it's about really trying to engage them in that. So many of the patients have been in hospital for a while, so they're quite deconditioned, meaning they're not strong enough to walk, to stand, to move and do the things that they would normally do at home. So it's about trying to improve that function. So a basic day, I guess the main assessments we would do on this ward would be to assess their showering, which is a little bit uncomfortable at times to begin with, but you do get used to it. So watching their showering, their dressing, their meal preparation as well. So we had a little kitchen set up that we were able to do like a little breakfast, so tea and toast, or we can make a meal for lunch or for dinner, so that was really good in there. So home visiting also comes under one of those assessments. So we would take someone out with us back to their home environment and just have a look to see how they're going within their home. Functioning with people who've been in hospital is quite different from the hospital to the home environment. A lot more people are comfortable at home, so you do see a little bit of a difference with their performance sometimes. And with home visiting as well, you're also looking to see how their home's set out. So is it really cramped? Is it lots of things in the aisleways that they can trip over? Is there lots of rugs on the floor or cords and things like that as well? So with rehab and home visiting, it's really about ensuring they're safe to return back home. And if they have any supports, then that's good. You can talk through them as well. If not, then it's about looking to see how we can make that environment a bit safer for them. And there's also a part of it with home modifications. So if you look at a part of the house and they need a ramp, we normally have someone that can install that ramp for them. So it's about putting some paperwork in there and some rails like you can see in that side picture. And also that's an over toilet frame, so that's some of the equipment that we can prescribe as well as OT. So it's just making them be able to do the things that they need to do still, but with a little bit of extra support. So still about maintaining that independence in their functioning.
Okay, so soft tissue is another area that OT specialise in, so that's got to do with massage and things like that. But it's not just about the massage and the physical manipulation of muscles, it's more to do with the person holistically. So it's looking at their injury, but then it's also looking at what caused the injury and what can be put in place so that it doesn't happen. So for example, if someone's had an injury to their knee, then we'll also look at what things, like what caused that, and also have a look at their home to see if they can return home and to make sure that they are able to ambulate, so move around their home effectively and get to the sick and get to the places that they need to go so that they can live a functional life. So with soft tissue, yeah, so it is a core aspect of OT to not just look at the person, you need to look at all the other factors. It's kind of like making a cake. You have to look at all the other ingredients that make up the person. It's not just the person. That you need to consider, like you consider them first, but you need to consider all the other factors. Yep, next one. And then research. So at the moment I'm doing my honours with occupational therapy. My project is parents' attitudes towards technology in secondary school. So research is very important with OT. So the reason why OT is such a specialised and sought after area is because that it is supported by evidence that what we're doing and what we're providing is effective in the rehab setting, and it is making a difference in people's lives. And it's because of this research that we can provide OT services, and we are able to work in all different areas, because all these areas are proven that OT works. So with that, with research, it's very important, and with also all the interventions that we provide, they're all research based. So for example, if we're going to request that a person has a certain type of equipment, then we know through research that it is beneficial for that person and will be effective. So everything, is well looked into, which is great. So research is great, and if you're thinking about studying OT and you get the opportunity to do your honours, you should definitely do it because it's pretty fun. It's a lot of work, a lot of hard work, but it's great to see results. So it's pretty fun. I've designed an online survey for parents, and so I'm hoping to get about 300 people to do my survey. So far I've got about 60, so I'm working my way up, and then I'll do a journal article, and hopefully that will be published, and then that research and those findings can get passed around to different communities and school groups so that they can have a better understanding of what parents think about technology. Yeah, so
Little YouTube clip. Is that the computer doing something funny?
The computer on here it's working, but it's not going on to. Oh, is it?